Hello, my name is Kristen Hobbs. I'm with Susan G. Komen Global Headquarters, and I'm excited to be presenting to you today on advancing breast health equity for African American women during the COVID-19 pandemic. Just a couple of disclosures. The landscape analysis I'll be referring to today has been funded by the Fund2 Foundation and Merck. Our authors are listed here, and this valuable work could not be done without the partnership of Susan G. Komen and John Snow Inc. Let's talk quickly about Komen's African American Health Equity Initiative. The goal of the African American Health Equity Initiative is to improve breast health equity for African Americans by identifying and addressing the systemic barriers that drive differences in breast cancer outcomes. Through this initiative, Komen works to achieve breast health equity starting in the 11 U.S. metropolitan areas where these inequities present the greatest. These metropolitan areas include Memphis, St. Louis, Atlanta, Chicago, Houston, Washington, D.C., Tidewater, Philadelphia, Dallas-Fort Worth, Baltimore, and of course, Los Angeles. Now, in the Los Angeles and Orange County metropolitan area, as compared to white women, African American women are more likely to die of breast cancer and be diagnosed at a later stage. This diagnosis often comes when treatment options are extremely limited and their prognosis is especially poor. What then do we do about these breast cancer inequities? How do we address them? Using a collective impact approach, Komen will identify and address the complex social issues in Los Angeles and Orange County through cross-sector collaborative action and investment to create community-driven systems change. Now, this can only be accomplished through evidence-informed, community-driven strategies that are based on local needs and led by local leaders. In order to understand the local needs of the Los Angeles and Orange County metropolitan area, a landscape analysis was conducted to collect data on the breast cancer and breast health landscape. Quantitative and qualitative data were collected, and a policy analysis was conducted on the local, state, and federal policy landscape. Without even having analyzed every single piece of data, we are already seeing that the inequities present in breast cancer and breast health outcomes are also present in COVID-19 and even exacerbated. Let's talk about the breast cancer landscape then in Los Angeles and Orange County. I want to draw your attention to Table 1 and the last two columns for late-stage incidence and mortality rates. You can see that Black women are diagnosed at later stages far more than white women in both Los Angeles and Orange counties. The same is true for the state of California average. When we look at the mortality rates for Black women as compared to white women, the numbers are increasingly higher for both counties and for the state of California on average. What then is causing these disparities and driving breast cancer inequities? We see in Table 2 for the health systems and breast cancer resources that 29% of the population in Los Angeles County are medically underserved and 18% of the population in Orange County are medically underserved. Could that be the reason? Let's look at the social determinants of health then. The social determinants of health are the conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. If only 8% of the population in Los Angeles County are African American and 2% of the population in Orange County are African American, why then do so many disparities in breast cancer outcomes exist? Does it have to do with economic security? The fact that 20% of African American women over the age of 45 are living below the poverty level in Los Angeles County? Does it have to do with food security and that 15% of African American households in Los Angeles County are receiving SNAP and EBT benefits? These are some of the questions we need to answer when we continue our inquiry with this landscape analysis. Next, we will complete the qualitative data analysis that will fill in the gaps to these questions and understand more of the landscape and how we will intervene. Reporting will come thereafter. Thank you.